My name is Karen Walker. I am a clinical nurse consultant at Royal Prince Alfred Hospital and the current president of the Council of International Neonatal Nurses. Let me just move down here. Just a little bit about the Royal Hospital for Women webinars. They're available on our social media groups with WhatsApp, the WeChat QR code for our colleagues in China, and you can email us on that very long email there if you'd like to be added to the social media groups. And there's a QR code here as well. Zoom etiquette, please ensure everybody's muted except when you're asking questions, and we will have 10 to 15 minutes at the end for Q&A. You can use the reactions button to raise your hands or use the chat box to write your questions in, and I'll get to as many as I can and SHELA will answer them. So I am delighted to introduce Dr. SHELA HIRANI, who's an associate professor at the University of Regina in Canada. And SHELA has won so many awards that Julie sent round and shared with us all. She is a very, very experienced neonatal nurse and midwife, and she's established a program of research entitled Breastfeeding Advocacy Research Program Practices and Policies. She's also worked in many countries, including Pakistan and Canada, and she's going to share with us today some of her work and her research that she's been doing. So I will hand over to SHELA. I'll stop sharing now, SHELA, so that you can share. And you should be able to share your screen and we can keep going. Yeah, I can see your screen.
Karen. Yeah, thank you so much, Karen, for this introduction. I greatly appreciate it. So, as you all know me, that Dr. SHELA HIRANI, I'm an associate professor at the University of Regina, Faculty of Nursing, Canada. And it's my great pleasure to be at this forum and present my research in disaster relief camps in Pakistan and share some of the important aspects surrounding breastfeeding care for the mothers who are actually residing in those kind of the precarious setting and in those kind of the vulnerable situation where they are facing the disaster every day and living in the tent in a different kind of situation where their babies and they themselves are very much at a high risk. And my today's topic gonna be breastfeeding in disaster relief camps with a focus on barriers and the key recommendations. First of all, disclosures. I acknowledge that there is no actual or potential conflict of interest. First of all, I would start with sharing the background. As I mentioned that disaster relief camps are one of the very, very vulnerable situation, and disaster is a time period when each year the deaths of 760,000 children under the age of 5 are reported, mainly due to the consumption of the unsafe water and the waterborne diseases. During the time of disaster and displacement, the promotion, protection, and the support of the breastfeeding is quite essential in order to prevent the childhood-related mortalities and the morbidities. So what happens that during the time of disaster, when they are having the no utensils, there are the unsafe water consumption by the young babies, especially if the babies are being formula fed, and they are at a very, very high risk because the water itself is unsafe, the formula feed is not a kind of an ideal nutrition for the young children, and many times babies end up into diarrhea, dysenteries, and many other kind of the health issues that are out of control because in the disaster situation, everybody is trying to save their life, and most of the time in those settings, we don't have the access to the healthcare system as well. And the healthcare professionals at times are so busy with the first aid and all, and many times like child feeding is one of those aspects that get neglected. So suboptimal breastfeeding practices and subsequent rise in the child mortality rate is very, very prevalent during the time of disaster and displacement, and therefore WHO recommends breastfeeding as an ideal option during that time. But unfortunately, during that time, mothers face various kind of the barriers. And what are some of those barriers we're going to talk about in today's presentation, and I will discuss some of those in the light of my own work in the disaster relief camps in the low middle income country like Pakistan. So literature highlight very clearly that although challenges associated with the breastfeeding during the time of disaster and displacement are prevalent globally, they are particularly problematic in the context of low middle income countries. And why I'm saying specifically low middle income countries, because at times there are no inbuilt system how to tackle the disaster, and at times the layout of the healthcare system is so different. They have a shortage of the healthcare staff. There are no adequate number of the neonatal professionals or the lactation consultants available. And interestingly, if I share that in the context of low middle income countries, many times they don't know who the lactation consultants are, because there are no such kind of the credentials that are officially practiced. And that's something a kind of a great concern. So here I would like to share generally the context of the low middle income countries and how their context of disaster and breastfeeding looks like. So whenever like in the context of low middle income countries, the disaster hit, there are no certain kind of the like condo building or like houses that are available right away for them. But the only option left in the context of low middle income countries are having the humanitarian relief agencies arranging for tents and shelters. So on the left hand side of my screen, if you see that there are temporary tents, and these are often not weatherproof. They are like quite smaller in size, have no washroom, no clean water. There are no such clean utensils available. And many times, like in the single tent, more than 2 families or 3 families are accommodated. And talking about the context of Pakistan or any of the low middle income countries, many times I have seen personally the family size even range between 7 to 12. So if you think of a relief camp or tents like these where around 20 people or more than 20 people are being assigned to a single tent, and mothers are with the young babies, and if they have to breastfeed, unfortunately there is no privacy in those kind of a scenario. If mother has to prepare the formula milk, because if she has received the donations, then she at times get a confusion kind of a state that maybe formula is a better option, and that's the reason I'm being offered the formula, and nobody is encouraging me to breastfeed the baby. And whenever like in the unsafe water is being used to prepare the formula, that is the time when the babies are getting so much microorganism in their own body, and then they are ending up into diarrhea, and the repeated diarrhea lead to the anemia and the malnutrition, and that are quite serious for the young babies. So here you can see that even in the context of the low middle income countries, there are so much of the power, control, and social exploitation in the lives of the mothers and young babies, and many times mothers and women face the gender-based violence in that context. And there are at times the widespread and the unscreened distribution of the formula milk. And even I have seen in myself, like in country like Canada, many times when the disaster hit, whenever they talk about children, the first option that donors think of, they're donating for the young babies, and what they select because of lack of awareness is at times the formula milk. They think that maybe if they're going to donate the formula milk in the context of disaster, that's going to be the situation that they can help the young babies. But in a way, they are not helping the young babies, but it's a kind of a negative effect on the lives of the young babies. And even in the context of disaster, if you see that there is no privacy for the moms to breastfeed, and specifically in the country context where mothers actually practice the whale system, or they prefer the privacy and they don't have the enough privacy to breastfeed, the only option they see is either not to breastfeed, not to feed the baby at all, or just to rely on the formula milk donation to be fed to the babies used and by using the unclean water and the utensils that are even not clean itself. Many times, like mothers themselves are having the compromised nutritional status during the time of disaster, and many times their stress level is so high, they're having the nutritional status kind of the compromised situation that they feel not ready to breastfeed. And apart from that, there are various myths surrounding the breastfeeding that is like very prevalent, specifically in the context of disaster in the low middle income countries. And personally, I have seen that people say that when you are in the stress, you should not breastfeed. And these type of the myths are actually somewhere causing the add-on kind of the barriers. So these were some of those challenges that I myself, as a neonatal nurse and as a researcher, came across while I was reviewing the literature. But I really wanted to unveil a kind of the more add-on kind of the barriers that the mothers are actually facing in the real scenario of the disaster relief camps, where the disaster relief situation is in active phase. So that's the reason I, during my doctoral work, wanted to conduct the research in the actual disaster relief camps in Pakistan. And why I chose Pakistan as one of the low middle income countries, because this country has the second highest infant and the child mortality rate in South Asia. This country is one of the South Asian countries that is sharing the boundary with Afghanistan, India, China, and Iran. And this is a place where they have a highest head child mortality rate. In 2010, around under 5 child mortality rate in Pakistan was reported as 86 per 1,000 live births, which is very, very high. The geographic location of Pakistan actually increases the susceptibility of this region to a variety of natural disasters, including earthquake, the flooding, the glacier lake outburst, and the drought. During the time of disaster, approximately 10% rise in the child mortality rate has also been reported in Pakistan, mainly due to decline in breastfeeding prevalence and subsequent rise in the child malnutrition rates. So actually, I wanted to examine the wide range of facilitators and the barriers so that we can identify that how to support the breastfeeding practices of those mothers who are hit hard by the disaster and residing in the post-disaster setting or in a disaster relief camps, and how mom's life as a breastfeeding mom looks like while being in those settings, which are itself a very, very vulnerable kind of the setting. So for my research, my work, I chose the theoretical underpinning of critical realism as an ontological perspective. And when we say critical realism, then we think of an iceberg. Here in the picture on my right-hand side, you're going to see that it says knowledge as the iceberg. Sometimes we believe that whatever the available knowledge is there in the literature is all that we should believe in. But my critical realist lens actually led me to think that maybe literature say that there is a power, control, exploitation, formula donation, and all these things are existing barriers, but I really wanted to explore the wide range of barriers so that we can actually better help out the breastfeeding mothers who are affected by disaster and residing in the disaster relief scenario. So using the critical realist kind of a lens, I had a philosophical understanding that whatever there in the literature is what we can see at the top of the iceberg, but beneath that there is so much of the reality to explore through the in-depth interviews, through the field observation, while being myself in that scenario where they are living in. And then also I wanted to have some document analysis, and also I used the epistemological lens of constructivism, in which a researcher actually take the mothers or the participant as an active involver or as an active participant who are participating in the co-creation of the data. So in that scenario, I really involved them. I built the trust with the participants who were living in the disaster relief camps, emerged into that culture, went there, met with the head of the village, the different type of the village where I traveled to, and then I co-created the data. So whatever I presented, I'm going to be presenting today, it would be the reflection of the participants' voices, the mothers, the breastfeeding mothers who were living in the disaster relief camps in Pakistan. So with using this critical realist lens, I also use my research design as a critical ethnographic design in order to identify the range of gender-based factors, the sociocultural factors, the economic factors, and the geopolitical factors that are directly and indirectly affecting the breastfeeding practices of mothers in the disaster relief camps in Pakistan. So here you're going to see a map in here. So the top notch, the top part, which is marked with the red, is actually the mountainous region in Pakistan called the Chitral area, which was having the highest number of disaster throughout the year. And even like this is a place which is even sharing the boundary with Afghanistan. And this area, Chitral, where I traveled to, was not only having the very highest number of disaster going on, and actively many families were living in the disaster relief camps, but also simultaneously there were lots of political instability in that region going on simultaneously. And because of that, mothers were not having a safe location to live in after repeated disaster and due to political instability. So I actually traveled to the 4 different villages in Chitral, including Shali, Zetur, Bishkir, and Bumbre. The data collection method that I used were in-depth interviews, field observations, and document analysis. And I undertook the in-depth interviews with the 18 internally displaced mothers with the young children aged 1 day to 36 months of the age, having the young babies. Either they were breastfeeding or not breastfeeding their babies, but still can contribute to the knowledge and help in the co-creation of the data and share their voices, that how exactly it feels like to be in a disaster situation, what are the barriers, and what are the key recommendations. My research was funded by International Development Research Center, IDRC, and Sigma Theta Tau International Research Grant. I had a collaborator on my study that was the Aga Khan Agency for Habitat, and that is also the subunit of the Aga Khan Foundation. So this humanitarian relief agency helped me in having the access to the disaster relief camps and access to the participants who were meeting my inclusion criteria. So here I would like to show that how Chitral actually looked like before the disaster, and after the disaster, how situation actually unfolded in their life. So I'm just going to play this video, very quick one. So here you can see that how like Chitral was in actual before the time of disaster, and after that, how hard it was with the population who were residing on those situations. And the time when I traveled to that region, all the road systems were too dangerous because they had a constant landsliding after the earthquake. The earthquake was in progress. The glacier lake outburst flooding was actually so intense that nobody was living at their residential land anymore. They actually lost their residential land, and the road travel was too difficult. So when I reached there and met with the humanitarian relief agencies, they told me that entering into the village, which is actually 6 hours away from Chitral city, is quite dangerous because the road travel itself gonna be too dangerous. There are no ambulances, there are no healthcare providers, there are no first aid in case if I get myself hurt by any means. And if I get engulfed into that natural disaster scenario myself and become a victim myself. And they asked me to that in case if you still want to go there, there is no hospital, and there is no residence over there that you can spend your evening there and start with your data collection next morning. So every time you have to come back to Chitral city by traveling another 6 hours. So, and they also asked me that you have to sign a waiver that if anything happens to you, then you're gonna be responsible. And they're gonna be the check post in between where they're gonna be the armed conflict kind of a prevention by the armies, and Pakistani armies were there at different checkposts. And every time I used to travel to the village, 6 hours road travel like the one that I showed on this slide. And then after bumpy road, so much of the landsliding, you had to face the armed kind armies who were asking me for my nationality, my ID card. I had to keep my ID card with them as an assurance that if there is any political scenario get worse, then I'm gonna be probably the responsible because I'm a new person entering into that village. It was so difficult for me as a researcher because I was also a healthcare provider, but simultaneously my positionality, my culture, my language, everything was too different. Although I'm a Pakistani, like I'm Pakistani as a dual nationality, but while traveling to this northern region with so many of active disaster and political stability, also I had to be responsible for my own self and for my own safety and for the logistics so that I can come back in a safe zone and come back to my second home, which is Canada. And that was a time I again took the kind of risk because I was so much passionate. I really wanted to know the stories of the mothers who are living in disaster relief. camps. And after the mountainous travel and facing the army checkpost, when I reached to the village, I didn't see any tents or camps. And when I asked somebody that where are the tents and camps, they said that now the residential land is fully covered with the mountainous debris after the glacier lake outburst flooding, and everybody is now living at the top of the hill to save their lives, because at any point in time there is a mountainous kind of earthquake, there is a sandstorm, and then there is a glacier lake outburst flooding, and then those who are at the top of the mountain may survive. So when I climbed the mountain that I never did in my lifetime before, I reached to the tents and shelters that were there at the top of the hill and mountains. And when I reached to the moms, I accessed those stories in the different villages in Chitral. And there was a time when I was interviewing my second participant. All of a sudden, the earthquake hit so hard that I had a feeling that the tent gonna fell down and I won't survive anymore because the earthquake was too intense. And everybody in that tent thought that this is the last moment of their life, and they actually read some of the verses from the religious kind of the verses that they believe in, and they call the God, and then they had a feeling that this is the last moment, and I had a feeling that that the same feeling as well. But fortunately, I survived, and I still continue with my data collection in that place. And I had a feeling that, see, I have an option to leave that place, being an outsider. But those who are still residing in those tents with a fear, every day the fear of death with the young babies is not that easy, because you have to be responsible to come back to the river, fetch water, go to the mountain again, live in a tent. At times these tents are not at all weatherproof. There are the cold of less than like minus 20 Celsius. At times you have to survive in those scenarios as well. So this was all the scenario, the layout of their environment that mothers were living in. So now I'm going to share that what mothers shared and what were some of the main findings. And in order to present my finding, I actually used the Braun-Verwerner's socio-ecological model. In this model, I selected because I actually was capturing the range of the barriers that mothers are facing while living in the disaster relief situation. So microsystem, this actually, before I go to the micro, meso, exo, and macro system, I would say that socio-ecological model actually consider that every individual is at the center, and they are surrounded by the layers of environment, and whatever the environment situations are, they are actually influencing the behavior of an individual. So when we say microsystem, it means an individual's health. So in this case, like I would say mother's internal system, mother's mesosystem means their family situation, mother's exosystem means their outer surrounding, their housing, their healthcare scenarios, their social network outside the neighborhood, and the macro system represents the geopolitical situation where mothers were living in. And all those layers of environment were actually having the kind of various influence on the mother's breastfeeding practices. And that's the reason I chose this model. So first of all, I would start with the facilitators that were supporting the breastfeeding of mothers while in the disaster relief scenarios. So mothers specify that the key maternal factors that really help them in sustaining their breastfeeding practices is their planning. If they really plan well in their pregnancy that they would breastfeed their babies, then this is a time when they really feel committed and they really reach to a decision to breastfeed their babies. That even helped out the mothers during the time of disaster. Mothers further specified that if they had a prior knowledge on breastfeeding and their nutritional status was good and they really felt resilient and they were successfully breastfeeding their babies. Mothers further mentioned that responsive caregiving is one of the area in the brain development of the babies that they are aware of, and they really want to breastfeed because they really want their babies to have a healthy growth and development, and they know the value of the responsive caregiving. Mothers further mentioned that whenever they practice the spirituality, they recite the verses of like Holy Quran or Bible or whatever like religious background they have. This is also strengthening them internally and even making them more resilient to breastfeed their babies. Mothers further mentioned that at times they have some wet nursing option available in their household if they have like sister-in-law or so at times those type of strategies also help them to sustain their breastfeeding practices. On the other hand, at the mesosystem level, the socio-cultural factors, mothers highlighted the importance of formal support from the healthcare providers. During the time of disaster, when mothers were living in those tents and camps, they mentioned that whenever like healthcare providers came to us and provided us some knowledge, some kind of a guidance, some kind of a breastfeeding counseling, we were like more motivated to breastfeed the babies. And if nobody was guiding us, then we were not motivated to breastfeed our babies and we were not having the adequate knowledge. On the other hand, mother also mentioned that since they were living in the environment where they were in direct contact with the extended family members like sister, sister-in-law, mother, mother-in-law. So they said that they were quite experienced and they were actually guiding their journey. They were providing more social support to them. And that's how they actually sustained their breastfeeding practices even during the time of disaster. Mothers further highlighted that during the time of disaster, the spiritual practices by themselves and by their family members even encouraged them to sustain their breastfeeding practices, improve their resilience, and even enhance their milk production. There is no scientific kind of an evidence, but definitely this is something that was even making mothers more calm, content, and resilient while being in disaster relief scenario where they were actually living in tent and there wasn't any water, sanitation, no washroom, no kind of other option or the healthy diet, but even spiritual practices were keeping them uplifted. Mothers further mentioned that in the village, if they have a breastfeeding culture, then that's a kind of a support to them that sustain their breastfeeding practices. On the other hand, like at the exosystem level, at the economic factor level, mothers shared that they are breastfeeding and they feel like breastfeeding because this is a cost-effective option. They don't have to buy the water, they don't have to arrange any kind of a feeding bottle or think of buying the expensive formula milk, and that's something which is like keeping them motivated that breastfeeding is readily available at a right temperature and it is even helping the babies in their growth and development, and this was something that facilitated them to sustain their breastfeeding practices. Few mothers mentioned that after the earthquake and glacial lake outburst flooding, not everybody were having the resources available, but few were having few money saved and few land area where they were having some agricultural activities going on that was producing some vegetables, and there were cows and cattle that were as their direct resources available. So when mothers were feeding themselves well using those resources, they were able to breastfeed their babies. At the geopolitical level, mothers mentioned that the relief agency plays a very, very important role during the time of disaster. Many mentioned that It's a relief agency who arranged a kind of the tents for them on time, give them some kind of a food item, asked them to be going to the safe place and directed them that what that safe place gonna be, and provided them with some humanitarian aid. And that was something that really facilitated them to sustain their breastfeeding practices. So here overall, no doubt facilitators as a whole were quite minimal as a whole, but they were still helping the mothers directly or indirectly. On the other hand, looking at what were the barriers that I identified for the mothers, the barriers were many as compared to the facilitators. And what were some of those barriers? Let's see what exactly I found in the microsystem. So mothers mentioned that if they themselves are having the compromised nutritional status, they at times feel so difficult to breastfeed their babies. Many mothers mentioned that after the disaster, they were having no housing, no privacy. And in case if their attribute was as a shy mother who is not confident to breastfeed or lacking the knowledge, that was something which was hampering their breastfeeding practices, and they were not able to sustain their breastfeeding practices if they were feeling shy to breastfeed in front of other people in the tent. They also mentioned that there are challenging transitions, like at times their tent on one day is on one hill, on the other day they really have to move to some other village to build a temporary housing there to save their lives. And that constant transition from one city to other, from one village to other, was actually negatively affecting their breastfeeding practices, because their whole attention was on the saving the life rather than on breastfeeding the baby by taking some kind of a break. Also, the psychological aftermaths. Many mothers mentioned that when they face disaster every day, living in tent, there are so much of the psychological aftermaths that they are themselves going through. They face PTSD, the post-traumatic stress disorder was quite prevalent, and they really felt that that is negatively affecting their breastfeeding practices. And at times, like, they have an insufficient breast milk. Many times, if they're not eating well, they are stressed out, they don't have a privacy, they don't have a proper support available, or they have a compromised health after the childbirth. And also, in case if their personal beliefs are not to breastfeed in public, then that also hampers their breastfeeding practices. At the socio-cultural level or the mesosystem level, the lack of privacy was the topmost kind of the concern that every woman shared at that place, that they really wish that there should be some mother and baby friendly kind of a tent where they could go there, breastfeed their babies, come back to their own temporary shelter. And as they don't have a privacy, it's something to breastfeed in public is going against their cultural norm. Many mothers who were Muslims and were preferring to cover themselves fully based on their religious kind of the cultural requirement, they really felt that the need of privacy is so intense that without privacy, if they are breastfeeding, then they are being like negatively viewed in society, and they really don't want to go against their cultural norm. And many times, like, mothers mention that when they are located at the top of the hill, where even healthcare settings cannot approach them, and even healthcare professionals can't reach them because of the border protection, kind of the political instability going on, plus active disaster. So even nobody is coming to them to offer them the breastfeeding support. Mothers further specified their cultural beliefs and practices. At times is certain that sometimes mothers are being asked by the elders in the community to feed the baby the cow's milk, and specifically at the age of 6 months. And many mothers were actually offering the tea to the baby or like feeding the cow's milk while simultaneously breastfeeding their babies. And that was something their cultural belief and practices that were not in favor of at times in supporting the breastfeeding practices quite well. Mothers further mentioned that there is so much of the covert oppression because they are being ridiculed, they are being considered like a woman as a weaker person, and in case like during the time of disaster, if they have to run and leave their placement with their babies without the permission of their husband or anybody who is an elder male in the household, then they are being considered as a person who is not respectful or not meeting the cultural norms. And that was something even making the mothers more depressed, because they mentioned that they at times face so much of the oppression and are being ridiculed by people in society if they are leaving their house without the permission of the male members, because it's a male dominant society. And that also negatively affects their breastfeeding practices. Many mothers mentioned that the family circumstances, especially during the time of disaster, they had to live separately. Everybody rushed to the safe place, and at times they got separated from their elder or the mothers or the mother-in-law or sister-in-law who were their social network and offering them the support. And when they were living separately, so the young mothers were not having the enough knowledge and the skills and no support to sustain their breastfeeding practices all alone. And here I would like to mention that many mothers who I interviewed, I came to know that they are getting married at the age of 14. And by the time they reach to the age of 20, they have around 5 to 6 children or babies, and all of them quite young. So early marriages were very, very common in that culture, and all the young mothers with so many young children were into that scenario that were very, very high risk. I've even seen that the mother who was only 40-year-old, and she really looked more than 60-year-old, and she herself mentioned that she's in a way young, but her circumstances, her workload to work in the field, to fetch water from the river all the time, take care of 7 to 8 kids in the shelter, arrange, cook, clean the house or their shelter, and even feed the cattle, take them to the mountain. So many workload all of a sudden, more than the males, are actually making them more older than their age. And even mothers at the exo level shared some of the factors that their basic needs are actually unmet. And many of them mentioned that one of the basic needs that remains unmet is food. They don't have enough food to eat. And whenever they have like a minimal amount or the quantity of humanitarian aid or food item available, then they really have to distribute it to the different members, like elderly, to the males, to the children, and women are the one who eat less and give more to the other members, especially to the male members, by thinking that they are the one who are the head of the household and their survival is important. Mothers further mentioned that the inadequate housing, that where there is no privacy, making their life more challenging. The financial constraint. After the disaster, they lost their house, they lost their agricultural land, at times they lost all the resources. And also the availability of the breast milk substitute, like if somebody give them the donation, they have a feeling that maybe this is a better option. And sometimes there are cows available in the villages or in their household, and people encourage them that why don't you feed the cow's milk instead of wasting your time on breast milk and breastfeeding your babies? Why don't you go to the field and do the work and grow the vegetable rather than feeding the baby? And by then we can feed the baby using the cow's milk. And that was something, another layer of challenges. And also economic loss was another area where mothers were feeling more pressure. They were uncertain that when their life gonna come back to normal, when they're gonna have the regular housing, the privacy, the family life, good food, and the better kind of the survival chances than right now when they are living in active disasters. So some of the other geopolitical factors at the macro system, I found out that there was so much of the systemic injustices also going on simultaneously in that setting. Although like apparently on television or on newspaper, we at times see that people were given the donations or humanitarian aid, but at times like the way it is being distributed, it really matters a lot. There were so many systemic injustices because people who were knowing, who were getting the donation and were being asked as a community head to distribute it to the people who are living and affected badly and living at the top of the mountain. So those community head at times used to keep the major chunk to themselves and distribute it to their relatives and friends rather than giving it to those who were more needy or were more in need. So few other barriers were inaccessible facilities. They were having no hospital, no healthcare. There were insufficient kind of the humanitarian aid, and also climate change was constant, like glacier lake outburst, flood, one after other, the earthquake and the landsliding, the difficult roads to reach to the different healthcare providers, and also there wasn't any free healthcare provider or support that were offered to them. So that was another layer of the challenges for the breastfeeding mothers. So looking into all these findings, you're gonna see that all those factors were interacting directly and indirectly with each other, making the barrier much more stronger than the facilitator themselves. So some of the recommendations that from the mothers' voices were, displaced mothers highlighted the importance of proper nutrition for themselves, and they said that the healthy mother means healthy baby. If they're gonna be having good nutrition, they can feed the baby. They also said that mothers should be supported to sustain their breastfeeding practices. Their mental health should be made as a top priority. There should be add-on support. Mothers further specified that at the socio-cultural level, they should be offered privacy. There should be the healthcare professional who should come and visit them. They should be offered the breastfeeding counseling facilities. Also, there should be religious rituals that should be practiced by the community, and local people should be trained so that in case of any emergency, local people have the empowered knowledge and they can actually help out the mothers who are affected negatively for breastfeeding, and they can offer the skillful support as well. So training of local people, especially local women in that villages and that are hardly hit by disaster, was something that was a very strongest in kind of the recommendation from the mothers. Mothers also emphasized that at the exosystem there should be baby-friendly housing for them, so that, or the at least baby-friendly kind of a tent that should be devised during the time of disaster and displacement, where they can go and all mothers can feed without any kind of a cultural barrier or religious norm, that they are not challenging anything, but they are actually meeting the requirement of the baby. And even like in Muslims, they say that as per their religion, they are being asked to breastfeed their babies up to 2 years. But also they require the support, the better support to help them to sustain their breastfeeding through proper privacy and better places where they can do that breastfeeding practices. Mothers also specified that there should be some funding for mothers so that they can buy nutritional items for themselves. In terms of the liquid assets, can definitely help them to buy those items. And also mothers emphasize on the importance of the financial support and specified that mothers should be provided the hygiene kits, because many mothers who were after the childbirth were menstruating, they were having nothing to have that practices continued. There were no hygiene kits that were provided, and the humanitarian aid that were provided was actually not at all female focused. So it was not providing any kind of information or any good nutrition supporting the nursing mothers, or no kind of the hygiene kit. So they really emphasized on that one. And also they emphasized that there should be the health and nutrition programs, and there should be the process of aid distribution should be based on justice. The shelter design should be such that mothers are having a separate washroom, or at least a washroom attached to their shelter where they can attend to their hygiene and they can remain clean during that scenario, so that when they are having the kangaroo mother care practice or breastfeeding their babies, they are not transmitting any kind of their own infection to their babies. Mothers further emphasize on having the accessible health care facilities and safety measures emphasized by the relief agencies. So these were all the recommendations from the mothers, and they really wish that if those could be in place during the time of disaster and displacement, and for the mothers who are residing in the disaster relief camps, that's gonna be very helpful. So from this research, the key recommendations that I came up with from the practice setting was that since the nature of barriers are multi-layered, we really need the multi-layered, context-specific and interdisciplinary intervention at the micro, meso, exo, and macro level to promote, protect, and support the breastfeeding practices of mothers in the post-disaster setting. And here I'm saying that it's not only the nurses who are responsible, but also doctors, psychologists, even engineers, the construction workers, and people who are nutritionists, and having the different type of the domain. They all can join hand to design the different type of the avenues and interventions for mothers, where they can have a better avenues to sustain their breastfeeding practices. At policy level, the key recommendation is that policies should be there to promote, protect, and support breastfeeding during the emergencies. And these policies must be developed and consistently followed by all humanitarian relief agencies, because it happens that if one humanitarian relief agency was supportive of breastfeeding, then other was not, and they were giving away the formula donation. And that was something creating more kind of an inconsistent approach during that time, because during the time of disaster, it's not only one humanitarian relief agency, but multiple relief agencies do play an important role, and they should have to have some kind of consistent kind of a policy to be followed. At the education level, my key recommendation is that there should be the courses on disaster management and call to innovation at the baccalaureate level, graduate level, and postgraduate level, in order to build the capacity of the healthcare provider and those who are even non-healthcare providers and belonging to the diverse field, because this type of education and training gonna be kind of an asset. And whenever the disaster hit, we do have professionals trained so that they know that when they are entering into the disaster, they should be following their cultural norm. They are offering the care which is as per their need and culturally sensitive. For the future research, my recommendation is that there should be future research that can uncover the facility and barriers to the breastfeeding practices of mothers who are also affected by armed conflict. So no matter like disaster is an important area, but also armed conflict, and many mothers like who I interacted with, they were also affected by armed conflict. There should be more research in that area as well. So the implication of the study was that it really helped in developing the nursing knowledge by having the better understanding and creating the understanding on the contextual factors affecting the breastfeeding practices. It also provided some guidance on programs, policies, and practices on ways to promote and support the breastfeeding practices of internally displaced mothers and how to attain the sustainable development goal number 3, specifically focusing on mothers and young children, and also had some kind of a recommendation for the future research and practice and education. So here are few of my publications that I really would like to share the screenshot of. So in case if you would like to access any of those, you are most welcome to reach out to me. So there are different type of articles from this particular work that gonna be a kind of guide in case if you would like to use in your practice or for your research. I can share definitely the full text articles, and I would be happy to share all those. And there are some kind of a challenges that I face, and even I narrated those in an article with some better strategies. So these are some of those areas that what future researcher can do if they are entering into the similar settings. Here are the references from my today's presentation. I would like to really acknowledge my study participants that they shared their experiences, voices. My collaborator and funding agency was the biggest source of support. Here are my contact details. If even outside this forum, if you would like to connect with me, would like to request full text or collaborate with me, I would be more than happy to do so. Here are my contact details. Thank you so much. And now the floor is open for questions.
Thank you so much, SHELA. And if you that's great. If you stop sharing, I'll just put up this. I'll share my screen, and then everybody can download the forms that if they would like to. There you go. The floor is open for questions here, as SHELA said. I think truly fascinating. The work you have done and is doing is amazing. You would know that we're revising while everybody's thinking of questions. And please put them in the chat or raise your hands. I am trying to monitor both. That the new revised Born Too Soon report, that it's going to be launched at the International Maternal Newborn Child Health Conference in May in Cape Town. There is so much, a whole chapter on the humanitarian and fragile settings, and the importance of breastfeeding and skin to skin cannot be underestimated. It is the way to save lives in these humanitarian settings. Questions from the audience. Anyone's got some questions there? While you were thinking, I was going to say those roads that you were traveling on, SHELA, look very scary as well. This is not a research question. I'm sure these will come, but for me, I was just looking at traveling on those roads. Was that quite scary?
It was very scary, and and even like the driver who was taking me there, he said that I saw like many people had the accident because it was just the one way. And in case if you are getting somebody coming in from the other side, then they really have to take a corner, and that's so dangerous. And simultaneously the landsliding was happening, and the road were super bumpy with 6 hours of travel was not a kind of easygoing task. Like it really had so much of the negative effect on your own mental health. Like when I came back from the field, I really had to give some time to myself to settle down, because it was not at all easy. And I had a feeling, oh, they are living into that situation. What gonna be for them to live in that scenario for lifelong, because they don't want to leave their motherland.
Yeah, so. Yeah. And I've got a question here. How long did you actually stay there for? How long were you in Pakistan?
So overall, I was there for 3 months, but I actually intended to live there for longer. But when the disaster one by one hit so badly, so from those villages, like I was asked to evacuate to save my own life. And actually, even I kept going on. I actually wanted to do more than 4 villages because they have around 32 villages, but their scenarios were too bad. So I couldn't be there for that intended 6 months, and I had to leave in sooner time period.
Wow, gosh. Another question here was, thanks for the great presentation. Was there any specific symptoms of the babies regarding shortage of breastfeeding during the disaster? I think that's related to the child morbidity and mortality, isn't it?
Yeah, exactly. So mothers who were not breastfeeding, so they were reporting the kind of a delay, developmental delay, and mothers mentioned that this child is 2.5 year old and not still able to walk, and the language development was delayed among the babies. Few were malnourished, and there were like kind of a different age groups. So everybody had some kind of the major impact on their developmental apart from the growth.
Mm. And another question here, what were the attitudes of the participants that you spoke to regarding the information for research during the post-disaster period?
They were very receptive. I would say that they shared that I actually was not expecting that type of a positive kind of a welcoming attitude, but when I went there, I met them. They all wanted to share their stories. They said that we wish somebody would have come to us and ask us what we have been going through, but unfortunately nobody came to us, because when they look at the roads, they see the active disaster going on, they have to risk their lives, so nobody is coming to us. But since you came to us, like they were so hospitable, and I can recall that they have a very small food to eat and they offered it to me. And he said that please you share this food with us and eat it whole, and this is something we really want to do for you. But they were so receptive, and I really felt that I wish that there could be more time I could spend with them.
Another question here, thank you, you're amazing. How is husband supports for mummies to breastfeed their babies during disasters? Were the husband supportive?
Yeah, there were few households where there wasn't any gender discrimination, and even like baby was taken care by the husband at times when moms were interviewing in the interview process. So there were fathers who were even taking care of the young babies, and they were putting them into the cradle. So husband was also supportive, but many of their husbands were not in that village anymore. They were either asked to be in the army, or either asked to be working in the city in different hotels or shops. So at times they were coming and going, but whoever I interacted with, they were quite supportive.
A really good question from Michelle here. Is it possible to somehow get the list of the relief agencies pushing formula? We can then support those who promote breastfeeding when we donate. Great presentation. That's such a good comment.
Yeah, there are not, interestingly, not one, but so many. Even like in Canada, I attended the first aid training, the relief agency training by Red Cross, and they said that at times we have to give away $500 gift card to the mothers in Canada whenever disaster hit, and that $500 gift card is only to buy formula. And I was so shocked because I never expected that even Red Cross people were gonna say this. And I said that, for example, mom don't have to use this gift card, $500 for baby formula, but for some other nutritional item to buy for herself so she can eat and breastfeed. She said, no, it's only for buying the formula. But this is just in one example, but there are many more humanitarian relief agencies who are freely donating formula, not only in low middle income countries, but also like many of these.
Oh, so true. There is so much money spent on formula marketing. We've got just the last minute here, so if there's any more questions. I think what you've done, SHELA, is you've highlighted, you brought their stories to life, which I think is so important. I was in Romania 2 weeks ago talking to colleagues from the Ukraine, and they were talking about breastfeeding and skin-to-skin in bunkers. And what you're showing, and what they wanted to do was tell their stories too, and it's so important that you're talking for these people that have got no voice over in Pakistan. So thank you. Are there any last minute questions? Because it is 2 o'clock and I know everybody's busy. How to keep mother breastfeeding her child? Check personally or give demonstrations and training by group? There you go. Last question. How do you keep a mother breastfeeding her child?
So definitely role modeling or the breastfeeding culture in the environmental context really helps, but the knowledge and definitely the initial go of the breastfeeding counseling really help. So at times you have to demonstrate the different positions. At times you have to give them some words, the prior experiences, and all those combination actually helps. Sometimes like it's being considered that it's a women's job to breastfeed, but from my experience, I would say that it's not only women who are responsible, it's a whole environmental context, like even country is responsible, city government is responsible, people in the social environment are also responsible for successful breastfeeding. So it's not the blame goes to mom all the time, but to everybody.
Yeah, takes a village. Thank you, everyone. And thank you all for joining our Royal Hospital for Women seminars. I think they're great. They run every Thursday for those who've joined. And that was a question from Indonesia there, SHELA.
Sure.
Thank you so much. If you want to contact SHELA, did you want me to put your email in the chat here, SHELA?
Yeah, definitely.
Yeah, let me just put your...
And definitely if you are looking for any such collaboration or any such kind of full text article or any further